Welcome to the Health Matters podcast, the podcast where we talk about why mental health matters, but we just call it Health Matters because mental health is just health. I'm Erin Mullins, and today we're interviewing Sophia, a college student who has been diagnosed with bipolar disorder, among other mental and physical struggles. We talk about what it means to live with a chronic mental illness and how she is managing to overcome. And now, time for the interview. So, could you give me a brief introduction of yourself and who you are?
My name is Sophia. I do photography in my free time, and I'm a psychology student.
At what age did the onset of your mental illness begin?
I noticed my mental illness getting bad at the age of 12.
And so, what was it like to start to develop mental illness at such a young age?
I think it was hard because of my background. I was born in a different country, um, and my parents didn't really understand how to deal with it. So it was more like they thought I had anger issues instead of bipolar disorder.
Yeah, it's hard when you don't get empathy because you're like, well, this is something that's a mental illness I have, which is treatable. It's not just a character flaw.
Yeah, exactly.
So, how does your mental illness affect your daily functioning?
It's pretty hard because some days, for many months, for example, like I get very depressed, like I don't get out of bed. It's really hard, and then other times I don't sleep for hours and hours, like 72 hours. Um like I have issues with like spending money or like being reckless or making spontaneous like decisions. So it definitely does affect like academics because I never know when I'm motivated enough to do it or not.
Yeah, that makes sense. It's hard to focus on academics and focus on bettering yourself when it's like your biggest focus is like this war in your brain. But it's hard because people can't always see that in the same way they could see like a physical disability. But when you get a diagnosis, like it's like you got that diagnosis from a professional. You're not just making something up.
Y- yeah, exactly.
What mental illnesses have you been diagnosed with?
PTSD, major depression disorder, bipolar, and seasonal depression. Sorry.
Yeah, that's quite a lot. It's good that, like, you're still in school, you're still, like, going for improving your life despite all of this. So, besides mental illness, what other struggles do you face?
I have fibromyalgia, which is basically like pain without like explanation. It's in your spine and your brain basically tells you that your body hurts and there's nothing like they can like do about it. It's not curable. I also have like fainting spells and other issues that I'm not comfortable saying at this time. But yeah, I do struggle with those.
I don't know if you've had this experience, but I think something that society at large doesn't seem to understand about mental illness is sometimes either like it'll get worse before it gets better, or it takes multiple years, or it'll take multiple attempts at different types of therapy to get better. And it's not just like you find one therapist, you find one medication, and it's magically better. Do you feel like you've had the expectations where, oh, now that you know you have your mental illness, it's solved, right? Or have you had something different?
Um, it definitely was a relief to find like the answers to my problems in a way of like my diagnosis, but no, it wasn't like magically. It took a lot of work and especially treating like my PTSD first. Um, it was very very hard. Um, I I started medication on Zoloft and yeah, that did not work for me. I had like very like numb like symptoms, so that did not work for me. But now I'm on different medication. I also changed my therapist that was very like open-minded, and that definitely helped me succeed in therapy. So I definitely do recommend that.
Do you think that, like, so, you have your coping mechanisms, but you still feel struggles because of your mental illness? And do you think society judges the mentally ill too highly? And have you faced any stigma because of your mental illness?
Yes, I have been judged before, like socially, especially because like a lot of people like they think I'm crazy, or like they don't know like how to like react to when I tell them, especially. So yeah, there is a lot of stigma that is portrayed in like media, a lot. It's getting a little better, but I don't think we're there yet.
So, do you feel like people have had ideas about who you are just because of your diagnosis, which aren't true?
Oh yeah, 100%. Um, a lot of people like see me and they think, "Oh, like it's just a normal thing. Maybe it's just you're feeling sad," and then like but no, it's definitely a lot more to it.
What do you wish people knew specifically about bipolar disorder?
I think the main thing about bipolar disorder is um it's not just it's not just one day I'm happy, one day I'm sad, one day I'm angry. It doesn't switch up that quickly. Um, but definitely be understanding that my emotions are there, but you know, don't take it personally. I think that's the biggest thing with a lot of people, because I can definitely get angry at times, but um like I think it comes from a good place most of the time, and a lot of people don't really understand where we're coming from because we don't some of us don't have like the emotional capacity to like really explain how we're feeling. We just go with the first thing that we feel and we go with it. And
Yeah.
it does take some time. It does some people like have cycles, like for example for me, like I stay like 6 months in depression, and then I'm manic the other 6 months, so it definitely is a challenge.
Yeah, it is a challenge, and I think something that's important for people to realize that while you do have your coping mechanisms, sometimes your mental illness is going to show up, but, like, you're still doing your best, and I think it's important for people to have compassion for symptoms of mental illness, and even if it's outside of that, I think we just need to have more compassion of understanding of each other in general, because everyone has a bad day, everyone messes up and says the wrong thing sometimes, and I think in order to create, like, a better future, we need to be more understanding with both ourselves and those around us.
Yeah, I definitely do agree. We all have our bad days.
So, you also said that you were diagnosed with post-traumatic stress disorder. I think post-traumatic stress disorder is something that can be portrayed in the media in like a very sensationalized way, either that or it's only associated with people who are like soldiers and got back from war, but it's actually a lot more common than that, and it doesn't only just involve flashbacks. What do you wish that people knew about post-traumatic stress disorder?
I think anyone can have PTSD about a traumatic event of their life, not just soldiers or vets. Um, for example, for me, like I think the biggest thing um, is that I feel anxious in certain places that the event happened. A lot of my events were at school, so I do feel a lot of like social anxiety, or or this is hard. um, a lot of like party environments, house parties. Yeah, it's very difficult to have myself put myself in large crowds. I think that's the main thing for me.
Yeah. And thanks for opening up about that because I think it's important for people to realize that post-traumatic stress isn't just in one moment you're suddenly like reliving your life. It deals with a lot of emotions. It affects your cognition in many different areas. And like as you explained, there's a lot of different everyday places where you are affected by post-traumatic stress, and others may not even realize that. And I'm sure that's really difficult to deal with. Yeah, because like a mental illness is like it's within your brain just like any physical struggles, but like you also have physical struggles as well. So to have those both compounded is probably really difficult to deal with on a daily basis.
Yeah, 100%. But we're staying hopeful.
What do you wish that the world knew about mental illness?
I think when someone tells you that they have like a mental illness, even if you can't understand it, I think validating that the person uh, that they feel that way and it's okay. Um, I think I think it's a lot better to validate their feelings rather than just dismiss them because you're scared of their diagnosis or who they are.
So as you mentioned, you face a lot of struggles because of your mental and physical illness, but that isn't everything. In what ways do you succeed in life?
In a lot of ways, I think like having being in the psychology major has helped me like understand more and have like something to look forward to. um I never thought I'd graduate high school. I never thought like I would move to another country and speak to you or speak another language. And I know several other languages. I traveled here and there, and all across Europe. And now, teaching and helping other people with their mental illness is definitely a life goal that I have.
Yeah, that's really great because if you're studying psychology and you want to be able to help people with mental illness, you will be able to relate because of your mental illness. It won't just be like you won't have something where you're like, "Oh, well, why is depression affecting you in this way? That's so dumb." Or you won't be judging them in the back of your mind because you know what it's like and you know the lived experience, which I think is can be really important.
Yeah, 100%. Even other mental illnesses that I can't really understand, but having a background on it definitely can help me help them the way um, the best I can.
So, do you think that with the proper support, people with mental illness can succeed and lead productive lives?
Yeah, 100%. Um, I do recommend you finding like a good provider and a good therapist, and a good like friends, family, anyone that can support you in the long run and cheering for you for your small goals, big goals. It's very important um, for anyone with mental illness.
So, speaking of support, do you think that the healthcare system properly cares for and supports the needs of the mentally ill, or do you think there's a lot of work that needs to be done?
There's a lot of work that needs to be done because um, although like medical professionals are trained to they have some sort of psychology background, but it's not fully there, and there's a lot of prejudice, and they usually put it mentally ill people in like wards, and sometimes they don't get the medical needs they need, or they don't know how to express that they need medication or some sort of help to get out of their situation, their environment.
Yeah, that makes a lot of sense. Like, I feel like personally, we stigmatize people by just saying they're crazy instead of realizing that certain behaviors might be a result of mental illness, but that mental illness is solvable and treatable. We don't, if there's someone and they're suddenly diagnosed with a physical illness, we don't judge them for that and we don't think that it's impossible to treat, but I think sometimes for some reason sometimes we think that people with mental illness are just going to be incompetent when really it's just one part of a much larger person and they can totally succeed just as much as everyone else.
Yeah, I do agree, but we also got to remember that um like mental health was definitely different from our parents' times and our grandparents' times. So it's definitely a new concept, and not everybody in the older generation will understand. But I do have hope for the newer generation that will improve our our healthcare system. So.
What coping mechanisms do you have to deal with your mental and physical stressors?
Um, I usually try to have a list on my phone about the things I enjoy doing, or I've been really into baking. Baking has been like really helping me like kind of stay focused and kind of just follow the steps and take one step at a time instead of just taking it all in and being overwhelmed. Um, Meditating is really helpful for me, and exercising when I can, when I don't feel physical pain.
How do you maintain hope when you're not just dealing with the your personal struggles, but we're in a really hard time for society at large? What do you do to be hopeful?
I think I think the best thing that we can all do is taking one step at a time, only on your daily routine. Even if you're just stuck in quarantine or at home, um, or your essential worker. I think not being so hard on yourself and just do the best that you can.
Yeah, I think I agree with you with not being so hard on yourself because like, I used to go at things from a perspective of being mad at myself would make me more productive, but actually, for me at least, I think it has the opposite effect because when I just get more mad at myself, then maybe I'll be anxious or I will feel, somewhat depressed, and it makes me less motivated to do things. And I really, instead of being productive, I just get caught up in the past. So, really, I think self forgiveness isn't just a nice thing. I think it can help you to succeed more.
Yeah, I do agree. In my depressive state, I usually do like small like checklist things, like even like brushing my teeth or like showering, like because it can be very difficult to do these like small tasks. So having like smaller tasks that you can do every day definitely makes you feel more hopeful. So yeah, self forgiveness is definitely a big one for me.
Yeah, self forgiveness is hugely important. So, on another topic, do you think that you'll find a way to succeed in life despite your mental illness?
Oh yeah, 100%. Like as much as I have those limitations and I just have to deal and learn how to manage it and control it because it's not curable. It's not going to go away one day. Um, Definitely taking my time and especially with academics, like I used to be very hard on myself and saying I'm going to finish college in 4 years, and Um, well, that didn't happen because of my mental illness, but I'm still staying hopeful, and I'm almost there. I'm almost finishing my bachelor's currently. So
Yeah, I think that's a huge accomplishment because it's hard for anyone, no matter how much privilege they have and whether what they deal with mentally and physically to try and like finish a bachelor's. So I think like you should be proud of yourself for that. Like a lot of people, even with all of the best things going on, don't finish a bachelor's in 4 years, like or don't finish whatever. Like college is really hard and that's where a lot of mental health program problems start to emerge. And I think it's really great that despite all these various diagnoses that you've dealt with, that you found a way to persevere and keep going and keep heading towards your goals.
great. Thank you so much.
Yeah. So Obviously, your mental illness affects you a ton in your everyday life. If you could just find a way to make your mental illness go away magically tomorrow, would you?
Um, I don't think so because even though like it's part of me, I but I think I wouldn't I wouldn't choose to go away completely. I think I'm proud of myself because even though I have so many hardships, it can definitely feel like I've accomplished a lot more than just saying, "Oh, I graduated high school." I'm almost done with college. It doesn't seem like big accomplishments, but um, having mental illness and physical illness, it is definitely a big accomplishment, and you can't just minimize your accomplishments. So, definitely wouldn't choose to make it go away.
Yeah, it's important that you're able to keep your accomplishments in check, but it is unfortunate that it still does affect your life and especially how people judge you.
Yes, there is. And something I would like to add also is that my college, for example, there's not very many resources for people who are, yeah, sure, we have the Student Disability Center, but it's really hard to get like documentation and go through the process. It's a very long process. It took me to apply for a disability in my school like about like maybe like 6 months to a year. Um, so and even they offer like free like 3 sessions for therapy, but yeah, I don't think it's enough to really um to really make students encourage more positive mental health in colleges and schools. So
Yeah, it's unfortunate that you had the experience where someone who needs the access most to services is getting a lot of barriers in receiving them because that's just going to widen the gap in what you can accomplish. But I'm glad that you finally found a way to get those that support from your college and I'm sure, find your own ways of coping. So, um like is there sorry. So is there anything else you would like to add about mental illness?
yeah, don't be discouraged if you are struggling with mental illness, even if you don't have a diagnosis. um I think like you can apply for student disability at your school if you have that resource, and don't be discouraged because you don't have a physical disability. You're less important than those who have one. I think we also need to make that known.
That makes sense. So if there was one more thing that you could tell everyone in the audience about your future, what would it be?
I think in the future I would like to work in like child psychology, definitely in the like social work department. I think that's where I'm headed, like I career wise. um and yeah, I want to find other like coping mechanisms because sometimes my own like coping mechanisms that I had for years, sometimes they don't work. So definitely that's where I would like to be in the future, in a better mental health state, getting better and better the more I do my treatment.
That makes sense. Yeah. Clinically based treatment will certainly help you in the future. Is there anything else you would like to add?
No, I think that's it. Thank you for having me.
Yeah, thank you so much for being willing to open up about everything you've been struggling with. So, during the interview with Sophia, we talked a lot about access to mental health care, either through disability services at a school, that could be professional help, it could be social workers, and we talked about the various ways that we handle mental illness. I think it's critical that if you want to support those with mental illness, you need to support access to care, and not just support access to any care, support access to humane care for people with mental illness. We need to make sure that mental health care is more accessible in America because our insurance system is kind of crazy and it can be very, very difficult for people to access the care they need. But if we just let people access the care they need, they would actually help out society because they would be more productive and they would be functioning better. So, really, we should just help people out because that empowers them. And when we empower them, they're able to just function and be productive and hold down a job and be a good member of society. So, in closing, uh, that really reminds me of this poem that I wrote. It talks about access to mental health care, and I'll say the poem. It is called "What Do You Want to Be When You Grow Up?" Two old ladies sit on a bench, talking together, must be friends. I want to be like them when closer to the end. Many people ask me what and who and where I want to be, but somehow none of them can seem to see that what and who and where I want to be is having a job with health insurance. My dream is a job with health insurance. Other than that, I would like to be like those two old ladies growing old together, sitting and talking on a bench. So, for me, that poem just kind of encapsulated as someone who's dealt with a pre existing mental health condition, how I'm always thinking in the back of my mind, how am I going to be able to handle this? And how am I going to be able to get the resources I need to handle my mental health condition? And that's always in the planning for my future. And yeah, that's it for today. That's a wrap for the Health Matters podcast.